on ABC Local Radio Queensland.
It's 20 minutes past 10. Chronic kidney disease is a shocking enough diagnosis. But why does it often leave those affected more susceptible to other diseases? And how can you improve your chances of never needing dialysis once you're diagnosed? A group of researchers at the Central Queensland University have been looking into this, and the study will now be published. PhD candidate Patrick Tucker spoke to Jackie Mackay about the causes of chronic kidney disease.
Any number of things can initiate chronic kidney disease. They could be something as pervasive as smoking cigarettes. It could be tied into a poor diet. It could be tied into a really lethargic, inactive lifestyle, different things like that. One of the molecular or cellular mechanisms that initiates chronic kidney disease, and that's what we're a little bit more concerned with, is this mechanism or this process of oxidative stress. There are lifestyle choices and different environmental factors that influence the amount of oxidative stress in our system. And if we do our best to try to control those influencers, we can reduce oxidative stress and enjoy a higher likelihood that we will avoid kidney disease. And that oxidative stress could start damaging a completely different tissue in our body, but the downstream manifestations might look like kidney disease to us. So one thing we do in this paper that we've just put out is we talk about the fact that a lot of these diseases are interrelated because of this oxidative stress, and inflammation, it turns out, is really important too. So one really tangible, easily accessible example that we use in this paper, in fact, is the relationship between oxidative stress and inflammation, and why people with kidney disease are more likely to have type 2 diabetes and heart disease as well. Imagine that there is some initial damage done in the kidney, damage that might have originated in the kidney will bring about inflammation. Inflammation, in turn, actually is producing more oxidative stress. So oxidative stress is harmful. Inflammation is there to clean up the mess that oxidative stress leaves, but in so doing, inflammation itself is creating a little bit of oxidative stress via its own metabolic processes that it goes through. So what usually is a protective mechanism, inflammation, is actually serving to create a little bit more oxidative stress. That is why if we have just a little inflammation and it comes and goes and doesn't stick around too long, then we're fine because we can kind of quench all the damages being done. Now, if we find ourselves in a state of chronic inflammation, so chronic kidney disease, for instance, or somebody that regularly smokes or regularly eats poorly, then we'll see that that inflammation that was serving a protective effect before actually ends up doing damage down the road. Now, once the damage has initiated, that damage can travel to other parts of the body, maybe the pancreas, and kind of exacerbate the processes that result in type 2 diabetes, or it can travel around different parts of the vasculature and create lesions and things like that, which are reminiscent of cardiovascular disease. So that's one reason why when people have one of these diseases, they're very likely to have other diseases as well.
Does it work vice versa, that if you have type 2 diabetes or heart complaint or whatever, that you're more likely then to develop chronic kidney disease?
Absolutely, that's a great question, and the answer is definitely yes. So somebody with type 2 diabetes is going to see more oxidative stress and chronic inflammation, which is more likely to in turn lead to kidney damage and damage in the vasculature. And somebody with that's prone to vascular damage is maybe they have high blood pressure. They are more likely to see systemic inflammation, oxidative stress that damages their kidney and or their pancreas and results in type 2 diabetes.
How long does it take, or does it vary enormously between, say, somebody who develops chronic kidney disease then coming down with the symptoms of type 2 diabetes or cardiovascular disease?
The rate at which these diseases start to progress is all over the board. What's important is if somebody knows what's going on and has even the most basic understanding of this process that we're talking about with the oxidative stress and inflammation, they can really, really slow down the progression of all three of these diseases, plus other diseases as well that we're not talking about right now. So it would be hard to put a hard number on how fast it progresses for everybody because it is different. But what we can say fairly comfortably is that people can slow the rate of progression down very, very well now. So well, in fact, that you could avoid potentially having to ever go on dialysis for the remainder of your life if you knew about your chronic kidney disease early enough. So if you're still in the initial stages of chronic kidney disease or any of these other diseases that are comorbidities, you can change the game so much that you can avoid dialysis for the remainder of your life, and you can avoid becoming diabetic for the rest of your life, things like that. So it's really good.
So that's the good news, but what do you have to do in order to achieve it?
Well, we talk about that a little bit in our paper. What we're finding and what the research is showing is that we've known a few things for a while. We know that diet is helpful, controlling the diet, and diet becomes especially important with chronic kidney disease. Anybody with chronic kidney disease knows they watch their diet a little bit more carefully than maybe a lot of their friends or family do. We find that, not surprisingly, people are watching their diet a lot with type 2 diabetes and cardiovascular disease as well. So it makes sense that diet is very, very important to all these diseases, as we would imagine. Exercise also very important. Now, exercise is tricky because there's a definite difference in terms of health benefits between things like walking around your block in the evening versus engaging in something like high-intensity interval training. So at present, there is quite a bit of evidence to suggest that high-intensity interval training, if done under the consultation of a healthcare professional, is actually more helpful for these people than low-intensity training like walking or jogging is. So that the high-intensity training paired with a careful diet really is the greatest or the best way to kind of stave off the progression of these diseases. Specifically right now, talking about kidney disease, of course, I should be clear on that. But the positive effects that are due to the high-intensity interval training and the proper diet kind of are beneficial across the board, and they help a lot of the other risk factors that are associated with these other diseases. So not only will you help maintain kidney function, but you'll also see reductions in blood pressure, better glucose regulation. So those are the two kind of hallmarks of cardiovascular disease and type 2 diabetes, respectively.
That's PhD candidate Patrick Tucker speaking to the ABC's Jackie Mackay. You're listening to Belinda Sanders on ABC Local Radio Queensland. He was the first African